As you can see, getting used to this format for academics is kind of an issue. We're used to a more freewheeling kind of thing, so please bear with us. If you haven't done it, it's harder than it looks, and if you have done it, you appreciate what they're doing. Our next presenter is Dr. Donna Gauthier. She's going to talk about shared decision-making for stroke prevention and atrial fibrillation, which is a mouthful.
It is. Can you hear me? No. Now? Yeah. Okay. This topic came about from a very, explosive personal experience. A 27-year-old nephew was diagnosed with a very rare form of appendiceal signet ring cell adenocarcinoma. And so I was in the room when he got the diagnosis, and the specialist said, oh, you know, this is what we're going to do. And he said, no, I want something else. So the theory of decision-making really became concrete. But now I'm talking about decision-making in the context of stroke and atrial fibrillation. As you can see here, stroke is the fourth leading cause of death in Louisiana. Heart disease is the first, and heart disease is an antecedent to, most of the time, an antecedent to stroke. So what is atrial fibrillation? I'm trying to tell you about this in a few minutes. But it is a dysrhythmia, an arrhythmia of the heart, an irregular rhythm in which the atria, the two upper chambers, are beating asynchronously and usually very, very chaotically, so that cardiac output and the blood flow just circles within that chamber, and platelets can aggregate and can form thromboembolisms. A very simplified model of how atrial fib can lead to a stroke. I was going to use the pointer, but I'm not sure if I have time. Oh, nope. So, anatomy of the decision. I mean, how does research deconstruct these individuals' feelings and thoughts and behaviors into individual units we call decisions? I know I can't do it. Economics, mathematics, neurobiology have come up with theories of decision-making, but certainly I'm looking more at the holistic context of decision-making. Now, shared decision-making is not new in the medical field or healthcare delivery field, but it is proposed as moving us from a more paternalistic context of medicine and healthcare to more engagement by the patient, the family, the unit. So this is just one context of a definition of shared decision-making. Now, Mead and her colleagues looked at reviewed the literature on decision-making of ethnic minorities in the context of a cancer diagnosis. This conceptual model is derived from their work, and the review of the literature resulted in three major themes: decisional role, decisional regret or satisfaction, and decisional role conflict. Now, decision aids are something that is coming about from the shared decision-making movement, I guess. Decision aids can range from just a paper that a healthcare provider and the patient review together in a clinical encounter, but it can be as complex as an embedded code within a patient's medical record that cues a healthcare professional that, ooh, something's not being done correctly, let's talk to the patient about it. So atrial fibrillation is research is generated by many things, but my mother was diagnosed with atrial fib in the 80s. She died of a massive stroke. My sister was just diagnosed with atrial fibrillation, and her journey of shared decision-making, again, is really on my mind and wanting to get back into that research. So her movement in decision-making, shared decision-making, she's taken a much more active role than her provider, very much, and has taken a tool to her provider to say, I'd like to be more involved in this, please, in every aspect of it. So I'd like to go back. I'm very interested, certainly, in that middle statement. that shared decision-making aid with anticoagulant therapy, because that's one of the most common medications used in the treatment of atrial fibrillation. But certainly the context of the encounters, because most decision-making research is done in that one time that decision is made, and we know that decisions are way more complex than that. Thank you.
Thank you, Dr. Gauthier.